I've seen loads of people this week with a runny nose. Now, yeah, of course, everyone knows that it can be caused by hay fever or by a viral infection, but did you know that there are lots of other causes as well? For example, there are lots of drugs that can lead to rhinitis, which is inflammation and running of the nose. This would include things like cocaine use and any other drug that you're shoving up your nose. But there are also some blood pressure medications that can worsen rhinitis. If you've been stable on one of your tablets for a very long time, it's unlikely that it would suddenly start causing rhinitis, but if you've started something new, there is a chance that it could be a contributing factor. There's also something called hormonal rhinitis. So this can happen when someone becomes pregnant, when someone starts HRT, so hormone replacement therapy, or even when someone starts any kind of hormonal contraceptive pill. There's also something called gustatory rhinitis, which is where you get a running of your nose when you eat hot and spicy food. And then there's viral rhinitis, which is usually associated with some sort of acute upper respiratory tract infection, which usually affects your ears, nose, throat, and it usually resolves by itself within a couple of weeks. But let me know, have you been experiencing rhinitis recently? Send this to someone who has a runny nose.